pretty unique is we're an undergraduate program that serves not only students coming from different majors, but students with very different career objectives. So I think we might be one of the only undergraduate training programs that doesn't focus, for example, only on people who want to go to medical school or only on people who want to become clinical psychologists. We will take anybody with a health interest and we'll help them figure out, well, what's their next step? Maybe it's health law, maybe it's public policy. A lot of them come in with a particular interest and then they decide they're going to add a minor in public health or they're going to pick up an MPH before they get their PhD. They're exposed to mentors from lots of different fields, so they will usually meet a health economist and a health psychologist and a medical sociologist and a clinical social worker doing research, as well as they'll meet some doctors, they'll meet some nurses who do research. But when you think about it, the average 18 to 20-year-old, when they think medicine, they think doctor, nurse, psychologist. They don't know that there are all these other professions that can contribute to health research, providing health care, health policy, and we help each of them find their own niche with their particular talents and interests. Which direction should they go for graduate school? We had our 20th anniversary conference 2 years ago, and we had alumni come back as speed mentors, as panelists, because they are now professionals out there practicing clinical psychology. They're working in the health policy arena, and they can come back and advise people who have that career path in mind. So we've got people at all stages of this pipeline we're trying to build. Let's say a student in this cohort wants to be a clinical psychologist. We will introduce her to somebody getting clinical post-baccalaureate entry-level experience now. We'll introduce her to people who are a year or two into a clinical doctorate. And then they'll meet somebody who has their doctorate already and is practicing. So now it's not a hypothetical idea that they can eventually become a clinical psychologist. It's an actual pathway where they see people who were in the seats they were in 5, 10, 12 years ago who are now where they want to be. And I think it really helps build that path and make it more concrete and feel more doable to exactly the students we're trying to train. Very high standards for you, but we have very high support. We want you to get there. We want to find out what your goal is and how you want to contribute, and we're going to help you get there.